It's long been clear that transgender and gender-diverse people living in rural areas have a more difficult time getting the gender-affirming healthcare they need. To learn more, Fenway Health teamed up with Cooley Dickenson Hospital and researchers from Harvard Medical School with support from the Panjandrum Foundation to determine the health and social service needs of trans and gender-diverse people living in rural New England. The PATH project brought together providers, researchers, and most importantly, an advisory board of transgender and gender-diverse people to guide the work and ensure that the process, questions, and eventual results were informed by local community perspectives, including youth, Spanish speakers, deaf community members, residents of the Berkshires, Springfield, and Holyoke areas, parents of trans youth, and healthcare providers. In all, over 400 individuals and families from across the region participated in the project. While there are numerous barriers to accessing care, the most common one is transportation. Many of those we surveyed lack access to reliable transportation, making it difficult even to get to a doctor's appointment. Other barriers cited include finances, language, and the availability of gender-affirming providers. Many people told us that their providers and clinical staff lacked basic knowledge about transgender and gender-diverse care. Clinical understanding and skill, especially in gender-affirming pediatric care, emerged as a major barrier to meeting community health needs. Parents of transgender and gender-diverse youth cited a need for pediatric endocrinological care, referrals for legal assistance, and resources for advocacy with schools, camps, and extracurricular athletics. Project participants shared with us a number of recommendations for improving gender-affirming healthcare. First, better training. Healthcare providers and their staff across the region need advanced, mandatory training on such topics as intersectionality, non-binary health, and basic affirming language. Second, better coordination. Healthcare organizations and providers need to work together to improve regional systems of care in order to better serve transgender and gender-diverse patients. Third, improved health navigation services. Community health workers should be part of patients' clinical care teams to help bridge the gap between providers and patients. With these data in hand, the PATH organizers and community health experts have been working to implement new strategies that build on community recommendations. We have two major accomplishments to report so far. Following the study, Fenway Health began a year-long trans-specific health education program in the region known as the Pioneer Valley Trans Echo. The model brings providers and frontline staff together for 2 hours every month for training and education, and also an opportunity for staff to discuss specific cases. The ultimate goal is to create the standardized, comprehensive training recommended by study participants. Additionally, in the spring of 2021, TransHealth Northampton will open its doors as a trans-led health center offering gender-affirming primary care, hormone therapy, and mental health care. While there is still a lot of work remaining, the PATH project provided an important opportunity to hear from transgender and gender-diverse community members and their families in Western Massachusetts and rural New England. We want to thank everyone who participated in this groundbreaking project and all those who continue to work for equity and justice in healthcare for all.